Okay, good. Kia ora mai tātou. First of all, welcome to Kokiri Marae, where I have released a 5-year review of the Healthy Homes Initiative, showing spectacular improvement across a range of measures, not the least of which decrease in hospitalisations, improvement in otherwise absences from school, improvements in employment, reduction in total benefits amount. Let's remember the Healthy Homes Initiative started in 2013, came out of the Rheumatic fever prevention program, has been modified and iterated over the time. This is the third report. First in 2019 was a 5-year look back, second in 2022 was a 3-year look back, and this is a 5-year look back across data which Neville from the University of Otago, the Healthy Homes Research Evaluation Unit, has kindly brought together. He makes the case that it is the largest community-sourced database in New Zealand. That's very impressive, and very impressive for the people who get the benefits from this initiative. And so with that, happy to pass to you for questions. So you need to speak up.
So in terms of rheumatic fever and overcrowding, despite the amazing work that's happening here, they're still on the rise. So what do we do now to address those problems?
Yes, so I've got attention on rheumatic fever. Several months ago, and we were talking about it earlier, I asked the team to do an inventory of services and initiatives across the whole country, and I believe that that's close to completion. And what I'm wanting to do there is to see exactly what we're doing and which initiatives, which programs are having the biggest impact. And then what I'd like to do is to standardise and roll that out across the country. So that piece of work, I'm waiting to come back to me, but I believe it's close.
Were you surprised to see that those things are still on the rise, considering this May?
Look, this deals to one part of one of the factors that relate to rheumatic fever, more specifically poor housing conditions and overcrowding. There are other parts to rheumatic fever, access to pharmaceuticals, access to diagnostics, etc. So this is a contribution, and this was birthed out of a rheumatic fever concern, and it is a contribution, but there are other things we need to be doing as well as this to help prevent rheumatic fever.
Neville raised the healthy home standards as well as being quite useful for convincing landlords.
Yes, look, I agree with that. I think that fully deploys July next year, is my understanding. And that will talk to issues around insulation and issues around landlord responsibilities to improve homes so that they can be more healthy. And yes, of course, we're supportive of that.
When you've been practicing, how bad have the health problems been that you've seen for kids living in crowded, damp homes, not just rheumatic fever, but others?
Sure. So let's talk about the social determinants of health, because, you know, we spend a lot of time talking about hospitals. Hospitals are the acuteness of medicine, which is maybe responsible or maybe interfaces with 20% of all the sickness and disability we have. The other 80% are the social determinants of health: income, employment, education, housing. And this is the housing contribution to those social determinants. Just remember that maybe 80% of illness and disability may be attributable to those social determinants. So it is very important to pay attention to them.
Moving on to the Waitangi Tribunal.
Can I just ask a question before that? Just on the Healthy Homes, given the results of this research, what extra financial support will the government be committing for?
So the next funding round is in the middle of next year, and the sort of evidence and evaluation we have here lends support for this to be substantiated. So that's what this evaluation does.
Why can't you announce something today?
Because it sits into a contracting round, and that needs to go through due process. So what we have here today provides further support for the benefits of these sort of initiatives.
So can you signal to us what level, what extra level of support the government is looking at?
What I can signal is that we're supportive of the Healthy Homes Initiative, that it will go through due contracting processes for us to make decisions around about the middle of next year.
Do you expect there will be more money for Healthy Homes?
What I expect is that this sort of information will be supportive of the initiatives that are clearly having benefits that touch multiple agencies.
So you can't say one way or the other?
Not until we're through the contracting round, but this is impressive information we have here today.
Did scrapping Whakawhāora breach the treaty principles?
No, I am aware and want to acknowledge the Waitangi Tribunal report, which I've only had very briefly. I will take some time, and we will take some time to digest that. There were 3 recommendations coming from that report. The first talks to a revision of a Māori Health Authority-like entity. That is not the direction of travel for this coalition government. The second talks about improved consultation. We always want to have improved consultation, and I would point people towards the emphasis we place on whānau engagement and whānau voice through the Iwi Māori Partnership Board, credentialing process that we're doing. The third thing I'd talk to is there was or the recommendation talks to parliamentary processes like regulatory impact statements being a default, a requirement for all legislation that touches Māori. These are the sort of considerations that I'll digest and have discussions with officials. The one other thing I would add is that what is really important is to look at the alternatives, and the report talks about the alternatives to the Māori Health Authority and then strikes it out in its terms of reference. So that's kind of a challenge.
So what consultation did you have with Māori about?
So I had consultation with Māori leaders in several years when I was in opposition around here's an alternative to the Māori Health Authority. I think we can do better for Māori health outcomes than the constraints and the structures of the Māori Health Authority. Here's what I'm thinking of. And so I had discussions with Māori leaders and had documentation from them.
What are your plans now to address Māori health needs?
So we'll bring forward the Māori Health Strategy, which will more specifically for health detail that in first quarter next year. And people can already see the substantial body of work we're doing around iwi Māori partnership boards, which are going incredibly well. Nearly all of them, certainly all of those that are established, have delivered their community health plans, spent a lot of time looking at what is the need in their rohe, what particularly does each rohe have as their health need, and then it's for Health New Zealand and the team to look at how we can deliver to the health need that's been identified. So I'm very excited with that progress.
So is that your kind of devolution approach?
Yes, it is. Delivery of care closer to the home, closer to the hapu. How closer to the home could you get than asking people, what are your health needs? What particularly, if you wanted us to focus on this or that, what does this or that look like?
The tribunal report said that the alternative plans for Māori health were expected in December. Were they wrong on that, or has it been pushed out?
No, the cabinet paper that talks about this says that there will be discussions or there will be presentations to cabinet, anticipating that it would be at the end of this year. It will now be at the first quarter of next year.
Why is that?
Because we want to get this right, and there's a lot of flux in the Māori health environment. As I say, the community health plans for iwi Māori partnership boards have just landed, and we want to have them precise when we embed them into the Māori health strategy.
Why has it taken longer?
To get a process really thorough and really robust, it takes time. And I don't mind at all taking that extra quarter to get this absolutely right.
Yeah, but you expected it was going to be done by December, but it's been...
Oh, correct. It's taken time. I mean, some of the...
So what's been the hold-up?
There's been a number of things. Some of the iwi Māori partnership boards are still defining at a mesh block level what their boundaries might be. And that's okay. No, not at all. There's also been some work that officials have needed to do. We've only recently, in fact about 2 weeks ago, got the technical group data around life expectancy, which is an important metric for Māori health that's only just come through. So we'll be ready in that first quarter of next year.
Do you accept that disestablishing the authority is based on political ideology?
No, what I accept is that disestablishing the Māori Health Authority was to deliver better health outcomes for Māori.
So why wasn't it based on political ideology?
Because it was based on better health outcomes for Māori.
What are you pointing to in that regard?
What's it, sorry?
What are you pointing to in that regard?
For better health outcomes?
Yes.
Oh, we could name any metric you want, because Māori does worse in all metrics. So if we look at life expectancy, for example, the recent data suggests that of the 7 years delta for Māori and non-Māori, there are a number of conditions we need to apply ourselves to. Lung cancer, coronary heart disease, COPD and diabetes are really what we need to be paying our attention to. And my government policy statement talks to that specifically.
Yes, but what you're arguing is your approach will do better at that
Correct.
than Māori health authorities.
Correct.
Are basing that on?
Correct. I'm basing that on a robust structure. I'm basing it on evidence that if we focus on targets and outcomes and have a structure that is well guided in that way, that we will deliver better health outcomes for Māori. The evidence for that is that when you have clear targets, amongst other things, you get improvements for Māori. The evidence is that...
What evidence are you citing?
Oh, okay. Let's talk to John Bonning, previous head of the Australasian College of Emergency Medicine, who very definitively has said targets save lives. So domain...
With relation to the Māori health authority?
No, just with relation to health.
Yes, so
but domain experts agree that targets save lives. So I'm quite convinced that we will do a better job for Māori and Māori health outcomes. Furthermore, the independent review of the Māori Health Authority 8 months after its establishment was not kind.
So will the iwi Māori partnership boards be appropriately funded?
They are appropriately funded, and in fact they're forward funded as well, and I'm committing to making sure that they have the resources to do what they need to do.
Why did you scrap it before the alternative solution was in place?
It was in place. This report chose not to include it in its terms of reference.
Have you had a demonstration doctors now fear that is in jeopardy based on the cuts to Te Ora recently. What do you say about that?
Yeah, so I think this is the TUI AI program, as I recall. Look, that's under the purview of Minister Matt Ducey, and so I don't have the details on that. I'm afraid you would need to ask Minister Matt Ducey for that. So I'm not aware if that's progressing, but I am aware that there is a work group working on artificial intelligence inside Health New Zealand and the Ministry of Health, and certainly Minister Judith Collins also has artificial intelligence across all of government as a key imperative for her.
So did you attend that demonstration?
No, I did not. It sits in Minister Ducey's purview.
Are you comfortable with the contractor and consultant spend at Health New Zealand, given this morning's report?
Look, it needs to be, and it has been reduced from what it was. The particular description this morning was around a payment system that is critical to the health system. Started in 2021, due to be deployed in 2030. And there were substantial contracting and consultant costs. And my expectation to Health New Zealand is to reduce those costs, to maintain functionality, but that is a critical part of the system. I think it manages roughly $5 billion of payments per year, so it is really important.
So you're referencing that specific 72 million spend?
Correct.
Right, and so your message to Health New Zealand is that needs to go down?
My message is that consulting and contracting spend across all of Health New Zealand needs to be well positioned and deliver tangible outcomes.
So would you agree with Health New Zealand, who have said that this spend in particular is the benefits outweigh the costs in this specific area?
Look, let's remember 2021, the most part of the spend wasn't in my hands, but very generally the answer to that is yes. When I understand the importance of this payment system, the answer would be yes.
Just on the job cuts, Te Ora Minister, Huhana Lyndon Green's spokesperson for health says that this is another broken promise in Frontline.
Well, I'm afraid, unfortunately, she's incorrect. My expectations to the Commissioner is that frontline services will continue to be preserved. If we understand that a large number, in fact, more than half of the proposed reconfiguration for Health New Zealand is with vacancies, we can see that the frontline is being looked after, and that reprioritisation of funds goes to the frontline, like the new funding I announced just this week up in Whangarei to increase SMOs by 50 places.
How do you think staff feel when you've got 72 million on contractors and consultants when you're going through this big job cut?
Oh, I can understand, but in the context of
what do you understand?
I understand their concerns, but in the context of the importance of this particular piece of IT and our desire and my expectations of Health New Zealand to reduce contracting and consulting spend, I think they'll understand.
Minister, just on healthy homes, sorry, we've done stories on whānau that have healthy homes, have an installation of a heat pump and stuff, but they can't afford to pay the power for that heat pump.
Different question. Look, that partly talks to cost of living and what we're doing to address cost of living, for example, with tax breaks and tax incentives. Is a different part. We'll look at, in the home itself, what structural elements do we need to change, beds, curtains, those sorts of things. I take your point that one can put in a heat pump and may not be able to operate it. We'll look to attend to that part of the equation through other policy settings.